Odevixibat 1200 Mcg Capsule is a medication used to treat skin itching caused by certain inherited liver conditions such as progressive familial intrahepatic cholestasis, PFIC, and Alagille syndrome, ALGS. In these conditions, a substance called bilirubin builds up in the liver, leading to symptoms like jaundice. Odevixibat belongs to a class of drugs known as ileal bile acid transporter inhibitors, and it helps to lessen symptoms of jaundice such as itching, yellowing eyes/skin, dark urine, and pale-colored stools. The recommended daily dosage and the best time to take this medication should be discussed with your healthcare provider. Before you start using Odevixibat, make sure to read the instructions for use leaflet from your pharmacist. Take this medication by mouth with food as directed by your doctor, usually once daily with the morning meal. You can take it in the form of a capsule to swallow or a capsule that contains pellets to sprinkle on food or liquid. If you are using the capsules that contain pellets, you must open the capsules and sprinkle the pellets onto soft food or liquid as directed. Do not swallow these capsules whole. For mixing in soft food, place up to 2 tablespoonsful, 30 milliliters, of soft food in a container. Keep food at or below room temperature and gently mix the prescribed dose in the soft food. For mixing in liquid, empty the pellets in a mixing cup and let the pellets sit in the liquid for about 5 minutes. Follow instructions on how to mix and give the liquid mixture using the oral syringe. If you are using the capsules to swallow, swallow the capsules with a glass of water. Do not chew or crush the capsules. If you have trouble swallowing the capsules, you may open the capsule and sprinkle the contents onto soft food or liquid as directed, using the same instructions as the capsules that contain pellets. The dosage is based on your medical condition, weight, and response to treatment. Use this medication regularly to get the most benefit from it and take it at the same time each day to help you remember. If you are also taking bile acid binding resins such as cholestyramine, cholesevalum, or cholestipol, take this medication at least 4 hours before or at least 4 hours after taking these medications. Tell your doctor if your condition does not get better or if it gets worse. If you experience diarrhea, abdominal pain, or vomiting while taking Odevixibat 1200 micrograms capsule, it's important to speak to your doctor or pharmacist. This medication has been prescribed to you because the benefit outweighs the risk of side effects for your specific condition. Most people do not experience serious side effects while using this medication. However, if vomiting or diarrhea persists, it can lead to dehydration. Contact your doctor if you notice symptoms such as decreased urination, dry mouth, fast heartbeat, or dizziness. While Odevixibat is used to treat liver problems, it may occasionally cause liver tests to worsen. Contact your doctor immediately if you experience symptoms such as persistent nausea or vomiting, loss of appetite, stomach pain, yellowing of the eyes or skin, or dark urine. Although rare, a serious allergic reaction to this drug is possible. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, talk to your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before starting Odevixibat, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to also share your medical history with your doctor or pharmacist before using Odevixibat. If you are planning to have surgery, let your doctor or dentist know about all the medications and herbal products you are using. It's crucial to discuss the risks and benefits of using Odevixibat if you are pregnant or planning to become pregnant. Additionally, consult your doctor before breastfeeding while using this medication. Remember to always consult with your doctor before taking Odevixibat 1200 micrograms capsules, as it may interact with other medications and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare providers. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's important to follow your doctor's instructions for the best results. If someone takes too much Odevixibat and experiences severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It is important to not share this medication with others. Before starting this medication, it is recommended to undergo lab and/or medical tests such as liver function and fat-soluble vitamin levels. It is also important to keep all medical and lab appointments while taking this medication. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the one you missed. Then, take your next dose at the regular time. Don't take 2 doses at once to make up for the missed one. When it comes to storing Odevixibat 1200 micrograms capsules, it's important to keep them at room temperature and away from light and moisture. Remember not to store them in the bathroom, and always keep them out of reach of children and pets. When it's time to dispose of this medication, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to properly discard this product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.